Over 37 million adults have chronic kidney disease, and most don't even know it. In this video, we're going to uncover the early signs that your kidneys are begging for help. Signs so subtle they're often mistaken for something else, or ignored altogether. You'll learn how everyday habits may be quietly damaging your kidneys, and more importantly, how to stop it before it's too late. If you've been feeling unusually tired, dealing with unexpected swelling, or even just peeing more often than usual, this might not be random. These could be urgent messages from your kidneys. Stay with this video until the end, because you'll also learn a 30-second self-check that could reveal early kidney problems before any serious symptoms show up. Now, here's something most people don't realize. Kidney disease isn't just something that happens to elderly people or those with diabetes. Recent research shows even young, healthy-looking adults can have early kidney damage, often due to things like dehydration, high-sodium diets, overusing painkillers, or relying too heavily on protein powders. What's even more shocking? Kidney damage often starts with zero noticeable symptoms. That's why today's video is so important, and why we're also going to share a quick self-test to check your fluid retention, along with a life-saving tip to reduce kidney strain starting today. Number 1. Constant fatigue that doesn't make sense. Let's dive deeper into the signs your kidneys may be quietly crying for help, and what each of them could be telling you. It starts with something many of us brush off far too easily: fatigue. Not the kind that hits after a busy day, but the kind that lingers, deep, heavy, and unrelenting. If you're waking up tired, dragging through the day despite getting decent sleep, your kidneys could be involved. Here's why. Healthy kidneys produce a hormone called erythropoietin. It tells your body to make red blood cells which carry oxygen. When the kidneys are damaged, they produce less of this hormone, which can lead to anemia. And when your oxygen levels are low, you feel exhausted. You may also notice pale skin, shortness of breath, or dizziness. If this kind of fatigue has crept into your life with no clear cause, it's worth paying attention to. Number 2. Puffy eyes and facial swelling. Another sign that might show up before you even leave the bathroom in the morning is puffy eyes. This isn't your typical lack of sleep look. We're talking about persistent swelling around the eyes, day after day. Why does this happen? When the kidneys are damaged, they can start leaking protein into your urine, a condition called proteinuria. Your body needs that protein to maintain proper fluid balance. When it escapes, fluid builds up in tissues like the delicate area around your eyes. If you're noticing this kind of puffiness regularly, or spotting foamy or bubbly urine in the toilet bowl, it's time to look deeper. Number 3. Swollen ankles, feet, or hands. Now shift your attention to your feet and ankles. Are your socks leaving deeper marks than usual? Are your shoes tighter by the evening, even though you've been seated most of the day? Swelling in the lower legs, feet, and even hands can indicate that your kidneys are no longer efficiently removing extra fluid and sodium from your body. This kind of swelling, called edema, isn't just uncomfortable. It's a visible signal of internal imbalance. Many people ignore it or assume it's just part of getting older or eating salty food. But when it becomes a pattern, it's time to investigate further. Take a photo to track the changes over several days. That visual record can be incredibly helpful for your doctor. Number 4. Frequent urination, especially at night. Let's talk about something many people deal with but rarely connect to kidney health: frequent urination, especially at night. Are you waking up more than once or twice to pee? Has it become a nightly routine that's slowly wearing you down? Damaged kidneys can't concentrate urine the way they should. That means your bladder fills more often, and you get the urge to go even if you've cut back on water before bed. It's not just inconvenient, it could be an early red flag that your kidneys are struggling to function properly. Look out for changes in color, strong odors, or a sudden shift in volume. These seemingly minor changes could be signs of something much bigger happening inside your body. Number 5. Persistent itching or dry skin. Now here's one that almost no one expects: persistent itching or unusually dry skin. While we typically blame seasonal changes or allergies, the truth is that kidney disease can also cause this. When your kidneys aren't doing their job, toxins begin to build up in your bloodstream. These toxins can irritate nerve endings, leading to a maddening itch, especially in areas like your back, arms, or legs. It's not always rash-related or visible, and moisturizers often don't help. If the itching is ongoing and unexplained, especially if paired with other symptoms we've discussed, it may be time to dig deeper. Number 6. Metallic taste in mouth or ammonia breath. Finally, let's talk about taste, specifically a metallic taste in your mouth or bad breath that smells like ammonia. If your morning coffee suddenly tastes off, or food you once loved now repels you, pay attention. This can happen when waste products, especially urea, start building up in the bloodstream due to poor kidney filtration. The result? Uremia, a dangerous condition that doesn't just affect your breath, it affects your brain, appetite, and overall well-being. Some people start losing interest in eating meat. Others report nausea or unexplained weight loss. But that metallic tang or odd breath odor can be one of the earliest sensory cues that your kidneys are overloaded. So, why does all this matter? Because these signs, fatigue, swelling, changes in urination, puffiness, itchiness, and even strange taste or breath are all signals. Signals from your kidneys that something is off. The problem is, these symptoms are easy to ignore, easy to attribute to other causes. That's what makes kidney issues so dangerous. They stay silent until it's almost too late. But not for you, not anymore. Now that you recognize the signs, you have the power to do something about them. And the sooner you act, the better your chances of protecting your kidneys and your long-term health. Now, as promised, here's a quick at-home self-check you can do right now. Press your thumb into your lower leg, just above the shin, and hold for 5 seconds. Then release. If the skin stays indented, that's called pitting edema, and it could be a sign of fluid imbalance linked to kidney issues. While it's not definitive, it's an early useful clue when combined with the other symptoms we've discussed. And if you want to give your kidneys a break today, cut down on sodium. Most people eat more than double the recommended daily amount of salt even without touching the salt shaker. Processed foods, frozen meals, sauces, and snacks are loaded with hidden sodium. Start checking food labels and aim for under 2,300 milligrams of sodium per day, or even less if you're at higher risk. Reducing sodium lightens your kidney's workload and helps maintain healthy blood pressure, one of the biggest threats to your kidney health. So here's what it all comes down to. Your kidneys are complex, high-efficiency organs. Every single day, they filter approximately 50 gallons of blood, regulate essential electrolytes, balance your body's fluid levels, and help control blood pressure, all without any conscious effort from you. But when they begin to falter, they don't announce it with sharp pain or dramatic symptoms. They decline silently, gradually, and often irreversibly. That's what makes kidney disease so dangerous. It progresses quietly until it reaches a critical point. But the earlier the warning signs are recognized, the more likely it is that damage can be slowed, managed, or even prevented entirely. The real power lies in early detection and lifestyle intervention. By staying alert to changes in your body, changes that once seemed insignificant, you're not just gathering information, you're giving yourself time. Time to take action. Time to prevent complications. Time to protect yourself from outcomes like chronic kidney disease, dialysis, or even kidney failure. Hydration, balanced nutrition, sodium moderation, and regular kidney function tests aren't just suggestions. They are frontline strategies backed by decades of clinical evidence. They can preserve kidney function, extend longevity, and drastically improve quality of life. The best part? It's not complicated, it's not expensive, and it doesn't require perfection, just awareness, consistency, and a willingness to listen to your body when it whispers, rather than waiting for it to scream. If you've made it this far in the video, you've already done more than most. You've chosen awareness over ignorance, proactive care over passive waiting, and that choice, simple as it may seem, is what separates those who protect their health from those who only react when it's already too late. You don't need to fear kidney failure. You need to outsmart it. Start today with what you know now. Which of these signs did you find most surprising? Share with us in the comments, and if this video helped you, give it a like, and sharing it could help someone else stay safe too. Health is about staying a step ahead. If you're ready to keep protecting yourself and your loved ones, click now to learn the early signs of cancer, knowledge that could truly save lives. Your kidneys might be silent, but now you're finally hearing them.